Good afternoon, everybody on social media. I'm Karen Lair with Idaho News 6, and we are going to be talking about the very important topic of vaccines in Idaho when it comes to COVID-19. And we have some local experts joining us to answer some questions live about the distribution, the eligibility, the timeline, and what we can expect, what's on the market, what's going to be happening in the next couple of weeks and months, as we know things have been changing a lot. So joining us live from Regence BlueShield is Dr. Amy Kahn. She's been with us on a lot of these kind of live town hall forums before to answer our questions. So we appreciate your expertise and thank you for being with us again. And then from the state side, from the Idaho Department of Health and Welfare, we have Elke Shaw-Tolik joining us to kind of talk about things on a state level when it comes to the distribution, how many vaccines our state is getting, and where it goes from there, because we have a lot of questions to be answered. So before we get to the eligibility and the timeline right now, let's first start off with what's out there right now. So Dr. Kahn, maybe you can help clear up some confusion right now. There's been a lot of talk of other vaccines that are in trial phases still and working on FDA approval. But right now, we've got the two vaccines that are being distributed across the country and around the world, and that's from Pfizer and Moderna. So what do people need to know about those two vaccines and what the differences are?
Right. So first of all, thank you, Karen, for including me this afternoon. I'm really looking forward to our conversation today. And you are right. We have in the United States two vaccines that have been authorized for emergency use through the FDA to prevent serious infection due to COVID-19 or the coronavirus, the SARS-CoV-2 virus that causes COVID-19. And what's exciting about these two vaccines is they are using a novel technology called messenger RNA, which essentially gives us the sort of instructions or recipe, ourselves the recipe to make the spike protein, which then stimulates the production of antibodies against this particular virus. So as you well know, these were authorized in December, both of them in December, about a week apart, and now have been distributed across our country, including all the parts of Idaho. They are a little bit different in terms of the storage requirements and whatnot, but they both have excellent effect preventing serious illness in 100% of the time, which is remarkable, with an overall vaccine effectiveness in 94, 95%, which is really terrific for a vaccine. And as you did mention, on the horizon, we will have soon another FDA review of a third vaccine candidate, which will be undergoing review at the end of February to determine whether or not it may also be included among those options available to prevent the ongoing spread of COVID-19.
And what would you say probably the likelihood of a third and maybe even a fourth vaccine being approved here in the next couple of weeks or months? Because there are a lot of different manufacturers working on this right now. So what's out there and what do we expect?
Right. So it's terrific. Through Operation Warp Speed this past year, we've had a tremendous amount of collaboration between public and private entities to develop vaccine candidates that use a variety of technologies. So this third vaccine that I mentioned that will be undergoing review is through Johnson & Johnson, their pharmaceutical division called Janssen, and it utilizes a different technology. I think the results so far that we've seen published in their phase 3 trials, and we'll learn more next week when we get the full report, shows that it is 85% effective in preventing severe infection, which is really the point, right? We want to prevent hospitalization and retain the capabilities and capacities of our healthcare system and prevent that serious illness that could otherwise result in death. And so 85% effectiveness to prevent serious illness, prevent hospitalization and death is terrific. And I think there's strong likelihood it will be approved after all of the safety data has been reviewed and the ACIP has an opportunity to determine which groups are it's recommended for, if you will. The great thing about this candidate is that it does not require the sort of strict cold storage requirements that the other two do. It has a little bit more stability. It's also a one-dose vaccine versus the two-dose, which is currently in effect with those messenger RNA vaccines. And then a fourth vaccine that's sort of on the horizon, I suspect we'll see in April, potentially an opportunity for the FDA review, is a Novavax vaccine. It uses a small protein fragment, which is similar to some of the other vaccines that we have today for other conditions. But that particular product or vaccine is looking pretty good in the trials. Again, it uses more of a traditional vaccine technology. So something to look forward to down the way in terms of later this spring.
Yeah, definitely a lot of progress has been made. And Elke, if you want to chime in on this third vaccine that we may see approval here in the next couple of weeks, because of the differences in the refrigeration requirements, how would this be beneficial on a state level, especially for rural communities in Idaho? And are you guys preparing for this third vaccine now?
Yes, we're absolutely preparing for this vaccine right now. We think it's going to be a great solution for us, especially in the rural parts of Idaho, just like you mentioned, because it doesn't have those cold storage requirements. It will allow us to get those out to out to the people. We know that they're definitely, especially in this older age population right now, and people that may have certain medical conditions or just the situation in which they're living, that they can't get to a clinic as easily. So this is a great opportunity in working through our local public health infrastructure throughout the state to be able to get these easy to move, easy to maneuver vaccines out to people where they are. So we are definitely planning for that. We've been told that we can maybe even expect these vaccines as early as the first week of March, depending upon how quickly, as Dr. Khan was mentioning, how quickly the federal review takes place. We've already been told that it will be very, very quick review. They're already gearing up and anticipate that they could have their decisions quite quickly.
Okay, and I'm seeing some comments coming in and some questions, and I want you guys to stick with us because we are going to be covering all of these topics. So Carol, Sharon, I see all of your questions and we are going to get those answered here. But first, before we get to some of that, are people able to, Elke, choose which vaccine they want to receive if they do get an appointment, or is it specific per provider that they only have one option, or how does that work?
Currently, right now, they do not have the choice. We are so limited in the number of doses that we have available that we really, the local public health districts are working with those local providers to essentially divvy up the vaccines that they have available. And so right now, it's based upon the capabilities of the providers administering the vaccine, what works best for them, because as mentioned, that Pfizer vaccine has some really kind of rigid storage and handling requirements because it has that ultra cold temperature. So depending upon who the provider is will depend upon what vaccine they have the capacity for. So right now with the limited doses and some of those issues, it's essentially the person that's going in to get the vaccine will get whatever that provider is capable of delivering.
Okay. And we can use this opportunity to also kind of expel some myths that have been circulating, especially online, about the vaccines that are out there. So, Dr. Khan, I'm sure you've probably heard some myths out there as well when it comes to, the shot can give you COVID. It makes you sick. It changes your DNA. What do you want people to know about the safety of these vaccines that have been approved?
Right. So, Karen, this is a great and very important question. We obviously want to make sure that these are safe vaccines. And I would start with respect to the messenger RNA vaccines, the Pfizer and Moderna.
Looks like we might be having a little bit of internet issues, just a sign of the time. So I'm sure Dr. Khan will be able to join us back here in just a minute, and we'll get back to some of those questions. But
this past fall, when we had the phase 1, 2, and 3 trials that were completed by the manufacturers. So there was a terrific amount of safety data that had been developed before they were authorized for emergency use. And since that time, I will say we continue to collect data on safety. There is an app that you can download when you get your vaccine, and that allows you to be informed about any information you might need to know about potential side effects. It's not uncommon to have a sore arm or even even feel a little achy or low fever within the first 3 days. But that particular app will be checking in on you weekly or daily for the first week, and then weekly for the first 6 weeks, and then every month thereafter. So it really is an opportunity to continue to collect safety data. So far, it has been remarkable how safe these vaccines have been. There is a warning, though, for people who have a history of anaphylaxis against the vaccine, that those people or those who might have an allergy to one of the components of the vaccine are advised not to take it. Now, many people do have allergies and allergy symptoms, perhaps even allergic to food items. People are monitored at the vaccine site for a minimum of 15 minutes, and if you have a history of allergic reaction, for at least 30 minutes. So I think it's a really important precaution. What we do know is rarely, roughly 2 out of 1 million on those receiving the Moderna vaccine and 6 out of 1 million of those receiving the Pfizer vaccine may have anaphylaxis. Of course, if that would happen, you wouldn't get the second vaccine. So we continue to also track adverse events through a national surveillance system as well, and individuals who do report significant symptoms would actually get interviewed. So in addition to the safety data that was obtained prior to the authorization in December, we continue to collect that information and will continue to do so for 2 years out, particularly for all those who participated in the vaccine trials.
Okay, well, Carol Morgan, I hope that answers your question about the reactions to the medicine and the precautions that are in place right now. So thank you for chiming in and asking that. And you guys can continue commenting your questions, and we are going to be getting to answering all of those. But before we move on to the distribution, Dr. Khan, I wanted to ask you as well. We've heard a lot in the news about the variants that have been emerging from this virus. What do we know about the vaccine's efficacy on the variants that we've seen so far?
Another terrific question, and I think we all are continuing to see how these new variants might establish themselves in the population in the United States. And what we know so far is that a couple of these variants appear to be more transmissible, more easily spread from person to person, a reason why we need to continue to keep up those new behaviors that we all developed and refined. Physical distancing and hand washing and really wearing a mask that fits properly on our face, because we don't want to transmit more infection, if you will. Now, the vaccine right now appears to be very effective against the variants that are predominantly circulating in the United States. Of concern has been one that has been reported, which may have the ability to evade the effectiveness, although the vaccines are still pretty good. Remember, we're starting out at a 95% plus of any kind of symptomatic illness. These variants are appearing to be still, addressed by the immunization. However, time will tell. If we see a variant that emerges as a predominant strain and we haven't been able to stop transmission, it is possible that the vaccines may not be as efficient as they were for that original wild type infection. Now, one of the positive things about the messenger RNA vaccines, as we fast forward into the future, if the virus has changed sufficient enough, we might see a vaccine that has now been modified to be able to code more specifically for the predominant viral strain, or maybe even see a bivalent vaccine or trivalent. That might sound familiar to some of you who regularly get your flu shot, where we know there are different strains of the influenza virus in which we're being protected against when we get those flu shots. So I think this is an important area of ongoing surveillance, and across our country and in Idaho through our public health labs, commercial labs, and our academic centers, we are looking at regularly tracking specimens to do the genomic or gene sequencing to really see what the predominant strains are and do tests to decide how effective the vaccines that are available are in disabling those viruses or preventing that illness.
Okay, well, we have a lot of questions coming in about where people can get the shot and where they have not had great luck so far. A lot of people say they're calling every day. They're calling St. Al's and St. Luke's and Albertsons, and they're unable to. So let's go ahead and talk about the distribution process. So Elke, from a state level, how many vaccines does the state have right now to work with?
Yeah, thank you for the question. So maybe it would be helpful if I gave a bit of an overview of how the whole distribution and ordering process works, because it'll give you the flavor of the nature of it. And on every single week, the federal government tells us exactly how many doses we can expect to get into the state. Idaho is currently receiving approximately 30,000 doses a week. 25,000 of those roughly come into the state as the state allocation. Another 5,000 roughly come in through what's called the retail pharmacy program. For the state allocations, when the federal government tells us how much we're going to get, we first get sort of an estimate on a Tuesday. They verify that by Wednesday. We contact the local public health districts. They then work in the next coming days with all of the providers that they have enrolled that are ready to vaccinate the priority groups that we're vaccinating currently. And then they tell us by provider, specifically by each provider, how many doses each of those providers will be receiving. And then we place the order with the federal government, and then the manufacturers then ship those vaccines directly to the enrolled providers that are requesting those vaccines. So that's in essence how the whole process works, and that happens every single week. So those first doses and then accompanying second doses for the first doses that happened a while ago, those all come in through that process. And every single week, we learn about every Tuesday how many doses will be coming in. So in general, we're getting about 30,000 doses into the state each week. Clearly, that is not even close to the number of people that are wanting the vaccine right now. Our supply is not meeting the demand, but we do know that they're going to be ramping up supply over time. And as has been mentioned, the opportunity to have that third vaccine coming into the state that doesn't have all those storage and handling requirements will be a huge benefit for us. Right now, we're receiving about 15,800 Moderna doses this week. And then for Pfizer doses, we're receiving about 16,000, sorry, I said 1,500, 15,800 Moderna doses, 16,380 Pfizer doses. So that's not including those federal, that retail pharmacy program, that's about 5,000 doses.
Okay, so I imagine a lot of people that are watching this that have had trouble making an appointment and getting through. I mean, I'm sure people are wondering, well, why can't the state get more vaccines?
Yes.
And I imagine that's a problem that a lot of states are having. So how is that working from your perspective and what you guys are asking for and what you're receiving?
So we don't get to ask how many doses we want to get. That's part of the problem. So it's really, again, it's that supply issue that every single state is facing the same issue. We're told what our allocation is. We're getting a proportion of the doses that are manufactured based upon Idaho's populations. So of course, every single state, every White House call, every governor has been saying we need more vaccine. We can't keep up with the demand. So we are, doing the best we can to get out the number of vaccines as quickly as possible. As soon as they get in, we want to make sure that those doses are available to the public. But we do know that it is incredibly challenging to make sure that we can even find the opportunity, that we can get enough people in and enough doses in to make sure that the supply is matching the demand. And so our biggest message right now has really been around encouraging people to be patient and know that everybody who wants to get a vaccine over time will be able to get a vaccine. It'll just take some time to get there.
And before we get to the timeline of that, I do want to direct people to the comments. We've shared the websites and the links for the Health and Welfare Department's page where you can go and find more information on the different health districts and the vaccine there. So you guys may find some of those links helpful as well. As you're watching this, you can browse there as well. So Elke, I wanted to ask you, we've seen some other states that have had these large scale mass vaccination clinics. They're doing them, in sports stadiums and large venues like that. Do you think that's in Idaho's future at all? And what would need to happen to get to that level?
Yeah, we don't anticipate getting to that. That's not out of the question, I will say that. So we're looking at every possibility as we get more vaccines into the state to do whatever we can to get large scale events going on. That said, there are we're calling them high throughput events that are occurring right now. For example, some of the larger hospitals are doing them here in the Treasure Valley. throughout the state. Some of the health districts are partnering with their local providers to do these more kind of large events. But they're all appointment-based scheduling. To do these high throughput events take a lot of logistical support, because we want to make sure that everybody participating in it is being as safe as possible, that we have the opportunity to, space them out, make sure that there's plenty of room for them to wait out that 15 to 30 minutes, depending upon the need for that individual. But really, it's when we get more supply in, absolutely, we'll start looking at more events like that. But for now, we're just relying on the local public health districts and their partners to do as high, large of scale event as they can at the time.
Okay, and for those that are watching that are curious about, whether or not they're eligible right now, there's been, different priority groups and a lot of 1A, 2B kind of terms thrown around that can get very confusing. So if someone is curious about whether or not they're eligible right now, how do they find out? I think maybe we can pull up the Department of Health and Welfare website if that's possible. But if you want to explain, Elke, who is eligible right now and who can get the shot if it's available?
Absolutely. I'll make it very simple. In Idaho, we have essentially group 1. That was our first group to be vaccinated, and now we're working on group 2. So group 1, that's perfect. You have our website pulled up, and you can access that through our coronavirus.idaho.gov. There's a bubble right at the top of that says when and where can you get your vaccine, and that will direct you to the page that's on the screen right now. So group 1 was focused on healthcare providers, as well as long-term care facility staff and residents. Group 2 that we're in currently is focused on frontline essential workers and people aged 65 and older. The governor chose to prioritize first responders, teachers in K through 12, teachers and staff in K through 12, and corrections facility and detention facility staff. And we're currently, as of February 1st, working on the group age 65 and older. So that said, all of those individuals that were eligible in group 1 and the beginning of group 2 are continuously being vaccinated right now. So it's basically, we just keep opening the pipeline a little bit more. What's coming up next after age 65 and older, which is a very large group, which is, you can see as you scroll down even further on here, will be the rest of the frontline essential workers to round out group 2. And then our COVID-19 Vaccine Advisory Committee is meeting. They're making recommendations about these priority groups and then making those recommendations to the governor. And we're actually meeting every other Friday. Currently, we might meet more often. We actually meet tomorrow, as a matter of fact, to start looking at that group 3. So that would be other essential workers, potentially people with medical conditions that put them more at risk. So there are more population groups, of course, that need to be prioritized. We've essentially been following the Advisory Committee on Immunization Practices and CDC's recommendations for groups. So in general, we've followed that, but we have made some modifications to that. So nutshell, currently, this website will show you who is eligible to be vaccinated right now.
And if someone has a question about, am I an essential worker, or I don't know if my job title fits into that category, is there a place that you're directing people to call and maybe ask those questions, or should they go ahead and make an appointment? What kind of proof do they need to bring with them? How are we making sure that these people are actually being vaccinated in the proper order?
Yeah, it's a great question. So there, for those first kind of 3 tiers of frontline essential workers that we started with before we got to age 65, the age bases are easy. That's easy to just show your driver's license or some identification. But with the frontline essential workers, we are working with industry to kind of connect an industry to a provider that's willing to do it. For example, here in the Treasure Valley, primary care was connected to West Ada School District. So they had an agreement that they would vaccinate all of their teachers and staff. So there's a lot of those types of relationships that are occurring right now to make sure that there's a direct connection between the provider and whatever industry is being served. law enforcement. They could come in, they could show their identification. As we get further into the frontline essential worker categories, we're working right now with the health districts to reach out to some of these larger employers, larger and smaller employers across the state, to make arrangements for those essentially industries to be connected to a provider, or work with like, for example, a local pharmacy might go into that facility, or they might make arrangements for that facility to send their staff directly to that provider. So it's a mix of different ways of doing that. If you personally aren't sure, you can call your health district on that same website that you just showed. As you scroll down, it has the phone number and the website for each of those health districts, and you can contact that health district and find out if you fit into those groups.
Perfect. So I know that's what a lot of people need to know, is we can't get a hold of anybody, and who are we supposed to contact? So we've seen a lot of those questions coming through, and Nancy, we hear your frustrations. Why talk about group 3 when people in group 2 can't even, get their vaccine done in an efficient way? So what do you want people to know, Elke, from a distribution or provider standpoint? What should people be doing if they can't get through on the phone? If they're trying several different providers, who should they be calling, and what's the best way for them to get an appointment?
Well, unfortunately, we do have to have that message of patience. Like I said, we want to make sure that everybody who wants a vaccine gets a vaccine. As the pipeline opens up and we get more vaccine to the state, it will be much easier. We are working on a statewide scheduling tool, or an application. It's very preliminary right now, so I don't have a ton of detail to share at this particular point in time, but a way that will augment what the health districts are doing. So at least we have a place where people can take action, get on a list, and then the providers can also access that list to then kind of recruit those people who sign up into their flow. But right now, we do know, we hear stories of phone systems going down, and this is not unique to Idaho either. Every state is dealing with the same issue of the demand being far greater than the supply. So just patients, keep trying. We know that more and more appointments are opening up. So we just encourage you to use the websites and the phone numbers that are on there, and look for a tool that we hope to have out the beginning of March that will also assist with this process.
And do you recommend, Elke, that people start with the health district, or should people be calling their primary care physician's office or the hospital they normally get treatment at? Or is there an easier way for them to access an appointment, or should they start at the health district level?
I think probably starting at the health district would be a great first step. We know that there are providers, of course, that are maintaining their own waiting lists and their own appointment schedules. St. Luke's, for example, you can go, I just even heard an ad on the radio this morning about it. You can go to their MyChart, and you don't have to necessarily be a St. Luke's patient. Primary health, I know, is also taking direct calls, as well as St. Al's. Mm-hmm. So at least for this Treasure Valley area, I know that to be the case. Other providers, the same thing. Some of them are maintaining lists, and others aren't, depending upon the size of the organization.
And for those who don't know, the health district's broken up by county. So we've got some of those phone numbers as well. If you go to idahonews6.com, we have a story pinned at the top of the page that's talking about what you need to know about the COVID-19 vaccine in Idaho. And we have that contact information for you. So depending on what county you live in, you can find the phone number there to get started with the process. But again, patience is what we've been talking a lot about. And Elke, I wanted you to touch on that as well. Right now, the timeline shows the general public being eligible come May. What kind of factors may change that and either speed it up or slow it down? And there's a lot of different things that kind of play into that. So what do you want people to know about that are in the general public category?
Yeah, well, our hope is that it only speeds up as more vaccine becomes available. This Janssen vaccine, as Dr. Khan talked about, will really be a game changer for us, because it will give us more vaccine into the state that has a much easier way to distribute it and get it out and access to the rural parts of Idaho. So vaccine production, we know that the Biden administration has really had a strong focus on increasing vaccine supply. So we're really all holding out a lot of hope that comes through, and we do get as much vaccine to the state as possible. So that will only speed up the process. Things that will slow it down is if, for some strange reason, the Janssen vaccine is not approved. I don't anticipate that to be the case. So barring any unforeseen circumstance with the Janssen vaccine for the immediate future, I don't anticipate any backwards momentum.
Okay, a lot of fingers crossed there. Hopefully we only speed things up from here. I wanted to also bring up a message that I think the Department of Health and Welfare has put out before. Maybe this has come from specific providers, but when you are able to make an appointment, talk about the need for people to only schedule the one appointment and what kind of problems are arising if people are scheduling more than one appointment with more than one provider or doctor's office or hospital. What does that then cause, like a trickle-down effect of?
Great, thank you. That's a great question. I actually brought that up in our press briefing on Tuesday. So that is something that we're also asking. In addition to patients, we're asking folks that we know it's sort of anxiety provoking, and everybody's calling around a lot of different providers trying to get on a list and make an appointment. So, and nobody's blaming anybody for wanting to do that so they can secure their spot. However, what that causes is when someone makes an appointment at multiple locations, that takes a spot for somebody else on somebody else's roster. And so we want to make sure that if you make an appointment that in multiple locations, cancel one of them or a couple of them, however many you have out there, so you have just one appointment, because it frees up that spot. It makes that schedule very seamless for the provider, because what we don't want to have happen is any of these doses being wasted. And if a provider can't then fill those spots quickly, or doesn't have a pool, they're counting on all of those people to show up for their scheduled times. So make sure that you do show up so someone else can take that spot, or they don't have a empty spot on their calendar, and therefore putting that vaccine at risk. Because once they are brought to room temperature for injection, they have a shorter lifespan, and they have to be used in a certain amount of time.
Okay. And Dr. Khan, I'll pull you into the conversation here. What does an appointment like this look like? When someone does actually finally get an appointment with their provider, they show up, what do they need to be prepared for, and what should they be expecting?
Yeah, absolutely. That's a great question. First of all, I think it's important to become, just think back through your health history. You're going to be checking in. You obviously want to make sure you're using those personal protective practices. The vaccine sites take every precaution to make sure that there isn't any kind of potential spread of the infection, the virus, if you will. And at the time of the check-in, of course, you want to advise the administrator about any, health history that you might have around allergies, that sort of thing. At the time that the vaccine is given, you will be given information about the vaccine, what kind of vaccine it is, what to expect, what it's used for. You'll also get a vaccination card that gives you the date, location, type of vaccine, an appointment for that second vaccine, as well as a link to the app, QR code that you can download to be able to receive that check-in information and get information about the vaccine. Anticipate staying at the vaccination site for a minimum of 15 minutes, maybe 30 minutes, particularly if you have a history of allergy. And the main thing is that you want to make sure you know where to go back to get your second dose, right? We want you to get the same type of vaccine. So if it's the Pfizer vaccine, the first shot, you want to get that in the second shot. It would be 3 weeks after the Pfizer vaccine, 4 weeks after the Moderna vaccine. We recognize sometimes there are circumstances that are not in your control. The CDC has advised that you can still get that second shot up to 6 weeks after the first dose under those circumstances where you can't get it in that 3-week or 4-week interval. So a really important piece, though, is to remember to, be aware of the side effects. I did mention to you that most people will have some local reaction. About 70% of people who've gotten these vaccines will have a local reaction at their arm. Their arm will be sore. Some people, if in a day or two, might notice some redness, even swelling of their arm. Less common, in the order of like a third of the people may feel fatigue, even maybe 25% or 25% will have a headache. And then somewhere in the order of 10 to 15% of the people will have things like chills, fever, joint aches, even nausea. Most of these symptoms will go away within 3 days. The older you are, the less likely you are going to have any of these local symptoms. Keep in mind that the younger people have more robust immune systems. And usually in the second shot is when you're more likely to have some of these side effects, if you will. Now, I know there's questions about adverse events, and I mentioned earlier about anaphylaxis. We continue to monitor this, and keep in mind that one of the targeted groups, of course, are elderly persons. In Idaho, we now have expanded that to age 65 and older. Many of these people have co-occurring conditions, may have underlying heart disease, lung disease, cancer, other illnesses. And so there has been a predictable rate of people who've died after getting vaccine. The issue is it wasn't caused by the vaccine. It was a likelihood of occurrence based on having a cardiac event within the population, death unrelated to vaccination. But this is information that we continue to track, and there now have been a few studies that the CDC has reported that the incidence of death following immunization is lower than what we would expect in the population given the overall morbidity or disease prevalence of other conditions in the population. But I think it's important that people understand that they need to report any side effects that they have. But thus far, the vaccines appear very safe, other than those sort of local side effects that I mentioned that really resolve within the first 72 hours or first 3 days after getting your vaccine.
Okay, I did see a question come in on that, so hopefully that question there was answered. And someone else was also asking about, is it true that there were no elderly or very few included in the trials? Dr. Khan or Elke, do you know anything about that as far as what the trials have been used for?
Yeah, it's a great question. There was a range of ages involved in the trials. Memory serves, Pfizer had a broader range, if you will, of persons who could participate, going down as low as age 12 and older. The Moderna, I think, started at age 18 and older. Moderna has been approved for age 18 and older. Pfizer has been, I should say, authorized for age 16 and older. And so we do know that there are trials underway to enroll younger people. In terms of the very elderly, I think that we are, continuing to gather data on the immune response to the vaccinations. But yes, there were elderly people enrolled. There were 44,000 people in the phase 3 trial for Pfizer, about 30,000 for the Moderna phase 3 trial. But I would also say with the, number of vaccines already given now to date across the country, we have many more people that we are continuing to do continued phase 4 surveillance, recognizing that we're going to continue to monitor them over time to see if there are other kind of nuances we need to know about. What might be more protective in an elderly person, for example, versus a younger person, and other characteristics that would be important to inform us as we have more experience with these vaccines.
Okay. Well, Lynn, we hear your frustrations. People can't even get one appointment, let alone make several appointments. But Elke, if you want to chime in, there are still a lot of people across the state that are receiving their vaccines. What are the numbers looking like right now? And I know they change every day, every minute, but how many people have been vaccinated so far with the first and the second dose? What are we looking at?
Well, that's a great question, and we have that information on our website. If you go to the coronavirus.idaho.gov website, you can see that information. And we actually have some new information out there, relatively new now, where you can go and see by provider how many doses they've received and how many they've administered. So there's a nice bar chart that you can see there. When we look across the state right now, we're actually seeing a really good uptake of the vaccine and administration rate across the state. We are pretty darn close to the national average when it comes to the rate of our doses being administered. And currently we have about over the course of time, about 400,000, a little over 400,000 doses that have been allocated to the state. And we've delivered or administered, we've administered about close to 278,000 doses. And then for our first dose, to date, we've about 200,000 of those doses of our first doses, and about 76,000-ish are second doses. So we're doing really well in terms of our doses that have been administered, and that equates to about 200,000 and 200,001 roughly people who have received the vaccine. So these numbers I just quoted you are slightly different than what you see on the page, because I have some more updated information than what's out there currently. This website that's being shown right now it's being updated every Monday, Wednesday, and Friday. But we are hopefully starting next week updating that daily. So you'll see additional information coming up.
Okay, and we know a lot of work goes into this behind the scenes. So we appreciate all of the updates that have been going into it on a state level to get this information out to the public, especially, you know, the weekly meetings that, you know, we cover every Tuesday and Friday. It seems like you guys are working really hard to get the information out there. So we do appreciate that. What else do people need to know, Elke, about when they make this vaccine appointment, when they do finally get a spot? Are they expected to pay anything up front? Does this cost anything?
There is no cost to the person receiving the vaccine. So the provider may they might bill the insurance company, for example, for the administration fee. If the person has no insurance, then there is a mechanism that providers can use to be reimbursed for that administration fee, but there should be no cost to the person receiving it.
Okay, that's good to know. And we have a question coming in that maybe Dr. Khan, you could help address. It's from Jamie Romero. It says, are there any recommendations regarding getting the vaccine and waiting to do mammograms due to the swelling of lymph nodes and immune response? Do you know anything about that?
Well, first of all, I appreciate that question. I think that's a really interesting question because we would expect some immune response and potential lymph node involvement. And I have not seen any specific recommendations about women waiting, say, before they get a mammogram. So I'm going to take that down as a note. I haven't heard that discussed yet at all. I will just mention that immune protection is conferred 2 weeks after the second dose, right? So people need to be aware that you want to continue to engage in those personal protective practices throughout that immunization period to have optimal protection from the vaccine. And we also know that people who are immunocompromised, you know, aren't necessarily in the targeted group yet, but will be, who are under the age of 65. You know, keeping in mind that, you know, we also know that people have high blood pressure, underlying heart disease, lung disease, diabetes, are individuals who are much more at risk for hospitalization due to COVID. And so it's important that these are folks getting their regular follow-up, right? Keeping in mind that, you know, other than this past year where we had this new novel virus accounting for an excess number of deaths, cardiovascular disease is still the leading cause of death in our country at over 655,000 people dying per year. So I think it's important that people aren't skipping their medical follow-up or making sure to take their medications as prescribed and monitoring, you know, blood levels, blood tests, getting that follow-up visit, really to keep those conditions in check, recognizing that they will be also, you know, priority groups as vaccine becomes more available.
Definitely a good reminder there. And Dr. Khan, what do we know right now about the ability to spread the virus after you've been vaccinated? Can you still get someone else sick?
Okay, that's a great question, right? I've told you that not only do you, prevent hospitalizations and death from these vaccines, you prevent that severe illness, but what about the potential for someone who's been immunized to have virus in their nasal passage and spread it to others? Well, what appears to be very promising news in several reports that have come out in the last week or two, it appears that we do secrete or express antibody in our nasal mucosa, which is terrific. and there have been some studies out of other countries that has shown that the when swabbed, the amount of virus is very minimal among those who've had the 2-dose vaccine. So it appears that we're probably not that likely to inadvertently spread this infection to others. The CDC just recently, I think it was last Friday, changed their recommendation and advised that people who've had the 2-dose immunization series after a couple weeks of that second dose do not need to quarantine if they've been exposed to a close contact of someone who has COVID. So again, suggestive of that protection. They do advise, obviously, an individual would monitor for symptoms, recognizing that we have identified some variants in the US now, the variant viruses that, may potentially cause, infection if they evade the vaccine. So I think that's a good sign that we're protected from transmitting inadvertently to others.
Okay, and we know the recommendations, they change all of the time as we learn more and more about the virus and the different variants. But right now, what are the recommendations for somebody once they've received the 2 doses and they've waited the, 2 or more weeks? Can they go back to normal? Can they see their grandkids? Do they still have to wear a mask? What are the recommendations right now for that stage?
Well, I'll start, and certainly Elke, feel free to jump in. Clearly, if you're among a group of seniors and you've all been immunized, right? I think that's an ideal situation. Being mindful of other, if people are feeling sick, obviously, you want them to remove themselves from the community, and so I think it's really good news for people who might be in residential settings or independent living that have seniors that they're gathering for meals or whatnot. If you're getting together with your kids and grandkids and say you're an older person who's been immunized, you still want to take some precautions, right? Because they may be exhibiting illness or potentially incubating virus. And again, I just have that caution out about the variants. When you gather, better to gather outdoors than indoors. And when you're indoors, limit it. You don't want to have 100 people gathered around a table or what have you, or in a small room. The point is you want to really still be a little bit mindful of that. But I think that we are well on our way to stopping the transmission in the community, given the number of cases continuing to drop. And the fact is that's part of the other value of vaccine that we haven't mentioned is the establishment of further herd immunity across our population. And I anticipate we're somewhere in the order of 25, 30% of the population is protected at this point. Getting it up a little higher, we can really stamp out the virus so it doesn't get transmitted. And by the way, it's less likely as it transmits to be circulating and potentially to mutate.
And we hear that term a lot, herd immunity. Do you want to go over that a little bit more? And, we hear it linked to like returning to life as normal once we get herd immunity, but what does that really mean? And when can we expect that?
Yeah, right. So a lot of this depends on the virus's characteristics. We want to know how efficient a virus can spread from person to person. And as we all know, this was a new virus none of us had any natural immunity to. So a herd immunity essentially means that when there's a sufficient amount of protection in the population where the virus is no longer able to propagate through a community. So as it bumps up to the next person, the next person, the next person, people are no longer susceptible. In fact, they're protected from getting infected, and then they can't spread it on to another person. It's estimated that the population would need to be somewhere in the order of 65 to 75% herd immunity for this wild initial virus. However, there is some concern that the variants, since they're more transmissible, transmissible may require a higher level of herd immunity. But I would just submit that we're already seeing some terrific gains and stopping the ongoing spread through not just immunization, but the other behavioral practices and even some of the environmental changes that we've put into place, whether it means waiting as you're in a store or staying away from crowds, or maybe changing or improving air filtration, really thinking about where we're conducting business so that we're reducing the likelihood that we have a pool of individuals where there's virus circulating.
Yeah, it's definitely changed a lot over the last year for all of us. What do you expect this to look like, next year, the year after? Do you expect us to be talking about COVID vaccines every fall like we do the flu shot? Is this going to become kind of a normal part of our year?
Well, I would say yes. I think that we are going to be talking about coronavirus. It is in our population now. I don't think it's a virus at this point. We're talking about eradication. I think it's a situation where we are going to be adapting to this virus. Whether we are looking at an annual booster because the virus has changed sufficiently and we need to be able to be further protected, maybe a modification like we've seen with our flu shots, or this is something that we can have immunity that's conferred for a longer period of time based on a stable virus that we have now sufficient antibody to protect us for a longer period. Maybe we would need a booster or get immunized on a more periodic basis every few years. At this point, we've only been living with it for just 14, 15 months at this point. And so we're still learning about the length or duration of immunity. We're still learning about the characteristics of this, but I would submit that, this particular coronavirus is probably going to be with us now for the duration. How we are managing it really is going to be key. And so far, we've done a terrific job, I think, in terms of the speed in which we've been able to produce effective vaccine. And we've also seen the amazing amount of kindness, courage, flexibility, adaptability that we as a population have made to just make sure we're tamping down the circulation of this pathogen.
Yeah. Well, we do have some comments coming in, and maybe Elke, if you want to help answer this. We have Carol Black saying, my husband is 65 with high blood pressure and he's diabetic. He also had his prostate and cancer removed and is still healing from that. We live in Soda Springs and they've been waiting for his shot. She's also high risk and supposed to get her shot next month. She has lung and oxygen issues. When can they expect to actually get their shots administered? What would you want them to know?
Hopefully you can hear me okay. I hope that you can hear me okay. There's a lot of static going on in this, but in the Soda Springs area, I'm not completely familiar with all the healthcare providers that are in that area, but that's where, certainly they can call their local public health district. I know I keep saying that over and over again, but that's a really important point to make, that if they have questions about that, make sure you call, find out who the healthcare providers are in their area. And it sounds like one of the callers has an appointment already, and they're just waiting for that to occur. It's hard to hear part of your question to me, but I would say that would be their first stop, is to reach out. And of course, the more, if hopefully we get that Janssen vaccine coming in the next couple of weeks, that will increase the chance of appointments being more readily available.
Hoping on that, that would definitely be helpful to help get the vaccine to more people in a quicker manner. Dr. Khan, if you want to help address this issue for Jamie Romero, asking again, do we have a record of how many people have had an anaphylactic response to the vaccine?
Yes, we do, Jamie, and that data are available through the CDC, through their VERIS system, but I have data to share. As of the end of January 27th, as reported to the ACIP, for the Moderna vaccine, there were 21 cases of anaphylaxis that mapped to a rate of 2.8 cases per million people vaccinated. So that was, quite a bit, almost 3 million doses given. Then we had also 50 Pfizer cases of anaphylaxis, mapping to 5 cases of anaphylaxis per million doses administered. Now, these data, again, were through January, mid to late January, so I know there's been many more vaccines given since that time. The important piece is that if you have a history of anaphylaxis, you'd want to report that to the vaccine administration site. Anybody who has an allergy to any of the components of the vaccine, so if you've had an allergic response that was severe to another vaccine that might have had a similar agent, that would be a relative contraindication. Still, there are some people who have history of severe allergy, potentially, maybe not to vaccines and certainly not to this vaccine because they never had it before. That's why the observation period is so very important.
And Jamie's asking a follow-up question on how does that compare to other vaccines for anaphylaxis?
That's a great question. It's comparable. I'd say it's pretty low. We have a number of different vaccines out there, but it's a pretty low rate of this sort of adverse, what I'd say, serious adverse event.
Okay. If you are watching and you still have some questions, you can feel free to answer or ask those there, and we'll try to get to those before we wrap here in the next couple of minutes. But Elke, what do you want people to know? We've talked about that window of time, depending on which shot you get, that you need to get that second dose, either 3 weeks or 4 weeks later. What kind of flexibility is there, and when are people making that second appointment? Are they making it when they get their first shot, making both appointments at the same time? How do we make sure people are getting their second dose in the right period of time?
Yeah, we are asking providers, the enrolled providers, to do everything they can to secure that second dose appointment at the first appointment. We're finding that to be very effective to ensuring that all of the people who need to get that second dose are getting it. That said, we have actually, a small percentage of, as Dr. Cobb was talking about people who may have some sort of reaction that is either making them trepidatious about coming back and getting their second dose, or they're just sort of lost to call back, if you will, to follow up. But it's a very small amount. And I'm even hearing from the Centers for Disease Control and Prevention, for example, that on the national basis, we're doing really well in terms of getting people back. And that's just a very small percentage of people who aren't either able to, or they're just lost to follow up. But that said, the best thing that you can do is at the time that you're getting that first dose, schedule your appointment immediately at that date. While you're sitting there waiting your 15 minutes, that would be the perfect time to schedule your next appointment.
Perfect reminder there. And what do you want, as we wrap things up, I'll let you each kind of give your main takeaways or what you want the viewers who are watching live to take away from this. So Elke, what would be your main message for people that are maybe still hoping to get an appointment and get a vaccine?
Yeah, my main takeaways are, again, to harp on the issue of being patient. We, like I said, we're doing everything that we possibly can to make sure that we get as many doses into Idaho as quickly as we can, and then out to the public as quickly as we can. Enrolling providers, we have well over 400 providers across the state enrolled right now, poised and ready if they're not already giving vaccine. So our capacity and our demand are great, and we just need to continue to get that supply in. So my messages are around patience. And while you're being patient, Dr. Khan hit on this, please make sure that you do all of those same measures that we've been talking about since the beginning of the pandemic. It's incredibly important to wear your face coverings, especially when you're outside of your immediate home. Make sure that you're maintaining that social and physical distancing, maintain proper hygiene. Those are very, very critical. We've done a great job in the state of Idaho in bringing our case rates down. Our positivity rate is down, hospitalizations are down, and we want to continue that trend. I think I also heard a message in there from Dr. Khan about, giving each other grace and, using that Idaho warmth that we all have. And, I know I have friends that have moved in from out of state that have commented on just how nice Idahoans are. So let's continue that trend and take care of each other.
Absolutely. And Dr. Khan, what do you want to add for what you want people to take away from this conversation?
Yeah, thanks, Elke. Yeah, and definitely, Karen, want to just reiterate that, we're all in this together. We've already made some terrific strides. I know many of us will get tired at times and get frustrated or whatever, but, just be there for each other to really encourage us to continue to move forward. It is terrific that we have the availability of these vaccines and more potentially on the way in the near future. Just wait your turn when it's available to you. Please take it. Be sure to, talk to your loved ones about what's happening and encourage them, and continue to, take care of yourself and make sure to, keep in line with some of those great practices. The hand washing, the masking, and all the rest of it has really become part of our lifestyle. And the main goal here is for us to return to our lives and our livelihoods, our schools, our workplaces, and re-engage in the things that we love most. So again, I want to thank you for the opportunity and really just appreciate the dialogue today.
Yeah, well, I want to thank you both for being a part of this conversation. We appreciate your expertise. There's a lot of stuff changing every day, and we're trying to get the up-to-date information out to our viewers. So I appreciate you answering all of these questions, and thank you to those who have been watching and asking your questions. If you missed any part of this conversation and you want to watch it back or maybe share it with a friend or a family member, this is going to be saved on our Facebook page. So you can go to Idaho News 6 and you can rewatch this same conversation. And we also have that important information for you on our website, idahonews6.com. If you still need contact information or phone numbers to contact your health district, that's going to be the best place to start when you're trying to make your appointments. So idahonews6.com, you can head there and find the information you need whenever you need it. So thank you both again, and thank you everybody for watching. We hope you have a great day.
Thanks.